In this two-part series, I'll talk about hot flushes and night sweats in menopausal Black women and answer common questions around these two conditions. Hot flushes and night sweats are among the most common symptoms women going through the perimenopause and menopause can experience. Most women of all races will experience them. However, studies tell us that Black women may experience menopause earlier than their white peers. Check out my video here where I discuss this in more detail. This means they experience the transition to menopause, which is also known as the perimenopause, earlier and may have to live longer with these troublesome symptoms. Hi, I'm Dr. Sylvia, a general practitioner and health educator, sharing with you health information videos to teach you more about your body and help you live better. Please subscribe to my channel and click the notification bell so that you know when we publish new health videos every week. In part 1 of this series, we'll be looking at common questions around hot flushes or hot flashes as you may prefer in the menopause. Next time in part 2, we'll look at night sweats. So, on to the questions. 1. What is a hot flush? A hot flush is a sudden warmth that spreads all over your body. Some women may experience a headache or an aching chest around the same time. Now, hot flushes or flashes are also known as vasomotor symptoms. They happen due to an imbalance of hormones, in particular estrogen, acting on the blood vessels around your body. Other hormones like progesterone, the stress hormone cortisol, and insulin may also be involved in how hot flushes happen. Many women sweat following a hot flush. Some sweat so much they need a change of clothing, while some women experience the hot flushes without sweating. Without treatment, hot flushes can be incredibly uncomfortable, embarrassing, and distressing symptoms of going through the menopause. Number 2, how long do hot flushes last? The duration of a hot flush varies. You may experience a single hot flush that may last anything from 1 to 5 minutes. In addition, you may have flushes that happen a few times a week, while for some ladies it is a daily occurrence. For someone who has severe symptoms, they could happen as frequently as 4 or 5 times an hour. And some ladies even report getting them 20 to 30 times in a day. On average, women who experience moderate to severe hot flushes are between the ages of 45 to 49 years old, and they last about 8 years in total. Studies tell us that if you're a Black lady, your hot flushes may last longer than your white counterpart. Number 3, why are hot flushes worse at night? Hot flushes can happen any time of the day, but they can be worse at night for certain reasons. First, erratic hormone levels. Women experiencing perimenopause or menopause have hormone levels that go up and down throughout the day. But these hormone swings appear to be worse at night, making the hot flushes happen then even more severely. Second is the room temperature. One of the triggers for having a hot flush is feeling or being quite warm before it starts. And this is common if you're in bed covered by blankets, wrappers, or duvet in a warm or heated room. So it would help if you avoided bedding with thick material that doesn't breathe well. Third, it's your diet. Studies on this area tell us certain types of food and drink can naturally increase our body temperature. These can make hot flushes more likely. Some examples are eating spicy foods, for instance with pepper and curry, or drinks that contain alcohol and caffeine. Okay, the 4th common question about hot flushes: when do hot flushes start? Along the menopause timeline, women who develop hot flushes can do so at any time. For women whose hot flushes begin early in the perimenopause, they may last more than 11 years. But those who start their symptoms later in perimenopause or after menopause experience a shorter duration of hot flushes. On average, a woman who suffers moderate to severe hot flushes may experience them for around 10 years. Number 5, what causes hot flushes apart from menopause? Well, Well, experiencing a feeling of general heat all over the body may happen in other conditions apart from menopause. Intense exercise, certain medical conditions like thyroid disease, cancer, or mental health problems like anxiety and depression may result in excess heat sensation. It can also occur after taking certain medicines. And going back to menopause, we recognize a few conditions that can trigger a hot flush. They include smoking, stress, spicy foods, drinks containing alcohol and caffeine, tight clothing or clothes made with unbreathable fabric, and warm environments. 6. How to stop hot flushes without HRT. HRT, or hormone replacement therapy, with either combination or single hormone therapy, is the most effective treatment for hot flushes to date. We recognize there are some risks with the use of HRT, so it should be used carefully and monitored. Still, the benefits far outweigh the risks in women for whom HRT is suitable. But that said, some women either do not want or cannot use HRT. So, drug and non-drug treatments can be used together or separately as alternatives to HRT. Most of the alternative drugs that have been shown to be effective in treating hot flushes are not hormones and are available only with a prescription. And they include drugs licensed for treating some forms of depression and anxiety. For example, SSRIs like fluoxetine or paroxetine, SNRIs like venlafaxine, drugs licensed for treating seizures and pain, for example, gabapentin and pregabalin, and clonidine, a drug that's used for treating headaches and high blood pressure. These can provide some benefit even though they're not as effective as HRT in treating hot flushes. A non-drug method which studies have shown is effective in reducing the severity of hot flushes is cognitive behavioral therapy, or CBT, that combines relaxation techniques, sleep hygiene, and lessons for taking positive, healthy approaches to menopause problems. These alternative measures are considered more effective than avoiding hot flush triggers or staying cool measures alone. Now, you may be surprised to learn that studies on some popular natural methods show they are not really effective in helping to relieve menopause hot flushes. Examples are over-the-counter and herbal medicines like black cohosh, dong quai, evening primrose, flaxseed, maca, omega-3s, pollen extracts and vitamins, relaxation, brain training techniques, and chiropractic treatments. Please watch out if you're spending a lot of money on these methods and consider that the other alternatives I've mentioned here may be more effective for you. And don't be afraid to speak to your doctor about how you can access them. That's it for this video on hot flushes. Give it a like and comment down below if you have any questions on the subject. Next time, it'll be part 2 with more questions around night sweats during the menopause. So make sure you subscribe to the channel, click the notification bell for video alerts so you know when that video comes live. While you're waiting for that to happen, check out these two here, and I'll see you again soon.